Stephen had always imagined that the birth of his first child would be the happiest moment of his life. He was ready for sleepless nights, for diaper changes, for the messy and beautiful chaos of becoming a father. What he was not ready for was watching the woman he loved unravel before his eyes. Only days after their baby was born, Stephen noticed something was not right with his wife, Grace. At first, she seemed restless, unable to sleep even when the baby was quiet. Soon she was pacing through the night, speaking rapidly about things that did not make sense. She whispered that the baby was not safe, that someone was coming to take her away. Stephen tried to reassure her, but her fear only grew stronger. Then she began to hear voices that he could not hear, and see dangers that were not there. Stephen realized this was more than exhaustion or the baby blues. Grace was slipping into another reality. She was experiencing postpartum psychosis, one of the most severe but least talked about conditions that can follow childbirth. Postpartum psychosis affects about 1 to 2 mothers out of every 1,000 births. It usually appears suddenly within the first 2 weeks after delivery. It is not the same as postpartum depression. It is far more acute and far more dangerous. Symptoms include hallucinations, delusions, severe confusion, and intense mood swings that can shift from mania to despair within hours. Without treatment, the risk of harm to both mother and baby is very real. For Stephen, the turning point came one morning when Grace barricaded the bedroom door with furniture, convinced that people were plotting to steal her baby. He called emergency services, terrified but knowing it was the only way to keep her safe. At the hospital, doctors explained what was happening. They told Stephen that postpartum psychosis is a psychiatric emergency, but also one that can be treated. Grace was admitted for care. She was given antipsychotic medication, and doctors worked to restore her sleep, which had been completely disrupted. Slowly, the voices grew quieter. Her thoughts became clearer. The fear and confusion began to ease. Postpartum psychosis does not have a single cause. Research suggests it is triggered by a combination of factors. Rapid hormonal changes after birth, family history of bipolar disorder or psychosis, sleep deprivation, and stress can all play a role. In Grace's case, doctors believed a history of mood swings combined with weeks of broken sleep contributed to her sudden breakdown. Recovery is possible. With the right treatment, many women recover fully and return to their families. Grace began therapy, where she learned to talk about her experiences without shame. Medications stabilized her mood, and a mother-baby unit in the hospital allowed her to slowly rebuild trust with her child under professional supervision. After several months, she returned home. Life was not instantly perfect, but she was safe, stable, and reconnecting with her baby. Stephen later said the hardest part was not knowing what postpartum psychosis was. He had heard of postpartum depression, but never imagined psychosis could follow childbirth. That lack of awareness nearly cost them everything. Knowing the signs matters. If a new mother is hearing voices, experiencing delusions, or showing extreme confusion, or rapidly swinging between mania and depression, it is not something to wait on. It requires immediate medical help. Calling emergency services can save both mother and child. If someone you know has postpartum psychosis, the best way to support them is to stay calm and present, avoid arguing about their beliefs, and encourage professional treatment. Offer practical help, whether that means caring for the baby, preparing meals, or simply sitting with them so they are not alone. Most importantly, remove shame from the conversation. This is an illness, not a reflection of character or love. Grace's story reminds us that postpartum psychosis does not define a mother. With quick intervention, treatment, and support, recovery is not only possible but likely. Stephen still remembers the fear of those early weeks, but he also remembers watching his wife slowly return to herself, holding their baby with a steady smile. Postpartum psychosis is rare, but when it strikes, every moment counts. By spreading awareness, we help more families recognize the signs, act quickly, and give mothers the chance to heal. If this video was helpful, share it so more people can learn about postpartum psychosis. Awareness saves lives. Check out our other mental health education videos.